Bismillahirrahmanirrahim. Today we will have case quiz number 8. Case data: 72 years old male. The main complaint: the patient was admitted to the emergency department with severe and sudden back pain. Necessitating the admission in emergency department. The patient had no history of falling or direct injury to his spine. The patient also had vague discomfort in the back of his pelvis and hips for the last few months, just vague discomfort. General manifestations: weight loss, tiredness, fatigability, GIT show marked thirst over the last few weeks. Genitourinary manifestations: the patient had frequency, nocturia. By examination, we found marked tenderness over T12 spine. Normal neurological examination. Investigations show hemoglobin severe anemia 7.9, white BCs within normal, platelet just slight thrombocytopenia, ESR shooting 104, CRB negative, creatinine slightly elevated or mildly elevated, and serum calcium increased above the level of the normal for this age and sex. So, what is the diagnosis? The answer is I think it is now today it is not so difficult as the previous case yesterday. It is multiple myeloma. Yes, it is multiple myeloma. Multiple myeloma. This elderly man has presented with acute back pain associated bony tenderness. The patient's blood test demonstrated a marked normocytic anemia, explaining his fatigue and slightly reduced white blood cells and platelet counts, which therefore suggest for possible marrow disorder. His calcium is raised, resulting in thirst and nocturia, which may suggest a long-standing process affecting bone. Finally, the ESR is very elevated in the presence of normal CRB, which might suggest a hematological process affecting erythrocyte sedimentation rather than a systemic inflammatory response. His renal impairment is pre-renal, which suggests an element of dehydration. We should here insist on the point of dissociation between ESR and CRB. In some cases, including multiple myeloma, there is dissociation between ESR and CRB. We can find ESR here shooting with CRB normal, and in other cases, we can see the CRB is high and ESR may be normal. For example, in the macrophage activation syndrome, the MAS syndrome, macrophage activation syndrome, the ESR may be decreased markedly. In summary, this elderly man has a combination of normocytic anemia, elevated calcium, and markedly elevated ESR, plus widespread profound osteoporosis, quirlytic lesions, and vertebral fractures. The most likely diagnosis is multiple myeloma. Multiple myeloma is a malignant proliferation of plasma cells or B cells beta cells here or B cells, which generate large quantities of antibodies or immunoglobulins. The abnormal cell line threaten normal blood cell production, which may lead to anemia, leukopenia, and/or thrombocytopenia. It induces enhanced osteoclast activity, leading to osteoporosis, increased risk of fractures, and hypercalcemia. And the circulating light chain impair erythrocyte sedimentation, causing an isolated elevation of ESR dissociated from the CRP. The main cause of renal impairment in myeloma are twofold. Not only does the elevation in serum calcium cause an osmotic diuresis and dehydration, but also abnormal light chains may cause direct renal tubular damage. And finally, thank you very much for your attendance, and we will meet you next time with case quiz number 9. Wassalamu alaikum wa rahmatullahi wa barakatuh.